So my name is Holly Farbo. I am the Academic and Industry Relations Manager of Aspen Dental. I am also a dental hygienist. I've been a dental hygienist for 21 years, and I was an Aspen hygienist for about a year and a half. I fell in love with the model. I really kind of lost my love for hygiene for a while there. I was burned out, and I went to an Aspen on a whim. It was the best decision of my life. I absolutely loved the way that we did our patients. And so it led me to this job where I get to talk to students and get the word out there about Aspen. So that's where I kind of came into this position. So we have Kira today. Go ahead and introduce yourself and give us a little background how you got to Aspen.
Hello, my name is Kira Brown. I currently work at Aspen. I have been a hygienist for 5 years now. 4 years have been with Aspen. I came along Aspen because I love their model that they really help patients deliver the proper care that's needed. They have a lot of ability to really bring a mouth back to health and different kind of opportunities as a hygienist to grow within their industry as well.
Great. So Kira, did you ever work at a private practice before?
I did, close to a year I did work at a
Okay.
private practice.
Okay. And were there other choices? Why did you choose Aspen? Was there a reason, or did you hear anything about Aspen prior?
I feel like Aspen has a perfect balance for private versus corporate. It has a good balance between delivering patient care, just it has more ability to treatment plan for patients, and you take ownership in treatment planning. So I know that the patient's getting the proper care that's needed across the board. And every mouth is different, so every mouth is treated different within Aspen. I love the support that Aspen has. There's a lot of outreach with Aspen that I
Yes.
appreciate.
Absolutely. So you might see me looking back and forth. I have questions that I'll be reading and asking for Kira. So let me just really quick, I always preface this with some people don't know what a DSO is. We are a DSO. It's a little bit different. People kind of group into corporate. And so we sometimes will say that word because that's what people understand. But Aspen's a little different. We're a DSO, which means we are a dental support or dental service organization. And those two words are intertwined also. So what that basically means is that our offices are owned by the dentist. So they're dentist owned offices. And I work for ADMI, which is Aspen Dental Management, which is the management company. So I always give the story of if there's a new dentist getting out of school and he or she decides to open their own practice, there's several avenues that they need to go by. So the majority of the time, hygiene school, dental school, they focus on patient treatment and not so much about the management side of a business. And so usually if a dentist was going to open a practice, they would hire a real estate agent to look for a place for them to find an office. And then they would have to hire somebody to do their payroll and somebody to do the office management part of that, doing billing and hiring people. And then you have the marketing, you need to have patients. So there's a marketing aspect to that. And if the office isn't doing well, then, the dentist might hire a consultant to come in and see where they can do. So we cut all that out. And we do that part. So we focus on the recruiting and the management side and all of that so that the dentist and the hygienist, who are both treated as providers, can provide for the patient and do patient care. So that's what our support is here. Okay, so let's start off with the most obvious question, since it's going on, is how has your appointment changed with COVID? What are you guys doing differently, and how does that look for you on a regular basis?
Within their appointment, it has changed because we pre-screen patients upon confirmation calls now, also upon arrival. Our lobby is slightly different. The patient now waits in the car, and when it's time for the patient to come in, we will phone the patient to come in. We do have patients also use like a pre-surgical rinse with hydrogen peroxide 1%, which we haven't did before, to help minimize COVID as well. Our PPE, we have a lot of PPE now. So I feel like we've been more proactive
Good.
for screening.
Yeah, and we
And
have
temperature check as well.
temperature check. Okay.
Hmm.
So we do, we have this program called the Smile Wide, Smile Safe Promise, which promises that we have 30 days of PPE in our offices. So that's something that's very important to us. There is a little question box at the bottom. So if you have questions, if, I can answer them live for you, and we can go ahead and do that. So, and so you have adequate PPE. Do you feel safe at your office?
I do feel safe in my office. Yes.
Good.
Yes.
So Aspen does things a little bit differently with their new patient exam. And so you are an office that's a single hygienist, correct? So
Correct.
you are just the only hygienist in there. And we do have models where we have double hygiene, and I can go over that a little bit about that model. But the single hygiene model, how do you see your new patients compared to a private practice?
So during our new patient exam, I'll still have my ongoing hygiene chair, and then you have to be mindful because at least you're going to see 2 new patients within an hour. You simply just excuse yourself and go do a comprehensive care treatment plan for the patient, and then come back to your hygiene chair and continue with your procedure.
Okay, so you'll have an existing amount of patients in, you have 2 columns, correct? You have a patient
Correct.
column of patients that you've already seen and treatment planned, and then you have your new patient. So when you're seeing your new patient, you have to leave from your existing patient. And was that a transition for you? I mean, how did you manage that?
It was a slight transition, but not so much because I love multitasking. So I do feel like when you're an employee with asthma, you have to learn how to multitask, and then it
Right,
just comes natural to you.
exactly. Okay, so here's another one that we always get, and these are questions that I get a lot from students. Students are very interested, obviously, in compensation. And one of the misconceptions about any DSO is that we are paid on commission. So can you really quickly, and again, it's just simply go over the compensation. Are you paid on commission? And how does that work?
We get an incentive. The incentive is basically just how productive you are within your chair. You still get your hourly wage so you can take care of your day-to-day bills. But the incentive is basically how well you perform as a hygienist.
Right. So we have, so you get an hourly rate that is guaranteed, correct?
Correct.
Okay.
Correct.
Okay. So how about benefits? Or do we offer benefits, and what type of benefits do you get?
Aspen do offers benefits. They have health, vision, short-term, long-term disability, have retirement funding. They do match as well. They also have it's an unlimited list.
It is.
Legal,
Yeah, it
like
is such a
legal
long list.
consultants,
Yeah.
accidental insurance, life insurance. So there's
Right.
a lot of ample opportunity there for benefits. Health
Right.
savings account, flexible spendings account as well.
Which
So
I took,
yes,
yeah, this health savings account I actually took advantage of this year, and it actually,
me
it
too.
was so nice. It totally saved me. So the life
Yes.
insurance, I believe, if I'm not mistaken, is up to $50,000 that we cover.
That Aspen
As
covers,
long as you
yes.
make, yeah, as long as you make that like up to what you make. So, I mean, the benefit package is really nice because, I know for myself, I worked 19 years in private practice, that that's not always offered in a private
Mm.
practice. I mean, you don't always get that. And so that's kind of a nice, bonus on top of that. So you're getting your hourly rate, which is similar to what everybody else in the area is getting. Plus you have this incentive plan, which, like you said, the incentive is based on you basically doing what's right for the patient.
Right.
So people get a little bit concerned about quotas. So they want to know, do you have a quota? Or is there a certain amount of patients that you need to see per day?
Ideally, on average, you should see about 8 patients a day, and ideally, do same day starts with your new patients is what we call it. Sorry, let me
That's
get my
okay.
notes.
Listen, it
Same day
happens.
starts with your patients, so at least 1 to 2 same day starts, one in the morning, one in the afternoon, ideally, because you want to give the patient the proper care. They were able to break down the barrier and come visit you and get an idea what type of treatment is needed. So while they're in the chair, why not start treatment today?
Right, exactly. So do you have autonomy on how you treatment plan your patients, or how does your treatment plan go? Is that something you discuss with the doctor? How does your treatment plan? How do you do that?
So we have a standard of care. Me and my doctor has calibrated among one another to have an idea of how to properly treat the patient. He trusts my opinion, my professionalism, I should say, and then I'll go in on treatment plan. And if we have any concerns, once again, we calibrate with one another.
Okay. So what kind of technologies do we use? What do you have in your office that you use to help with diagnosing your patient?
We have, we take x-rays, we take a bite wings, full mouth, FMX. We also take panels, and we just go off the findings that we see on the x-rays and also a full perio chart.
Full perio chart. So how often are you doing your perio charting?
With every patient.
With every patient?
With every new patient gets a full mouth perio chart. And then you have your patients that's for your hygiene chair, which is like periodics. You'll do that once a year or sooner if need be, depending on the measurements of the pockets.
Now, do you have a handoff with your doctor?
We do have a handoff system.
Okay.
Yes.
And so, is there ever and this is a question, I'm sorry, I didn't mean to interrupt you.
That's okay.
A question that I got, if there's ever, and some people don't have this issue ever, but if there's ever a time when you and your doctor may slightly disagree, how does that conversation go? Have you had that conversation? And, what's that like?
We have our disagreement. We're only humans, but we always have a common ground. So we come to a neutral agreement of what to ideally treatment plan for, and then we will reevaluate within a certain time span and simply document it.
Right.
And we'll revisit it. And so
the nice thing about documentation is very important. Correct. Everything's documented. How about, another question I get all the time is about selling. Do you have to sell products? How do you go about recommending, or what's the process with the products that you give?
There's no pressure in selling products, but we do offer a range of different, we call it adjuncts, additional things to add to the treatment care plan to help the patient better care for their oral hygiene at home. So there's a lot of range of different products that they could use at home. And I would simply just discuss it per patient mouth. No patient mouth is the same.
Correct. Right. Do you guys have an iTero machine in your office?
We do not.
Okay.
But so we have local offices that carries iTero for the Invisalign. Yes.
And that is something that we just discussed. And that's something that we're going to, we're initiating within all the offices. And so Correct. It's kind of it's a process that we're doing, but the iTero machine, a lot of the offices do have that. It's a digital scan of the mouth. It's a 3D tool, which is really nice. You have an intraoral camera that you use?
Yes.
Okay. Yes. And that's also another nice tool to have. What other types of services do you offer for hygiene other than scaling, replaning, and prophies? What other things do you do?
We offer a lot. Well, we do the scaling and replanning, but we can add an antibiotic, and we use 2 different antibiotics. We use Arrestin and Atrodox. We offer Zoom. We can do in-office or take home. We offer like desensitizing toothpaste, whether it's Clinpro, MIPaste. We have different rinses, whether it's chlorhexidine, stainless, dry mouth gel. It's just per patient discretion of what their mouth simply needs.
So are you able to order your own supplies? How does that work?
We are. So there's about 2 times within the month that we're able to order our products. Another thing, Oral-B. We use Oral-B toothbrushes. I'm sorry. You get a monthly budget. My monthly budget is $2,200. So you get to order as needed. You want to simply divide that and use, the first quarter of that month to utilize the products, and then the second quarter to utilize anything else that's necessary, whether it's instruments or simply things that you need in your operatory.
Perfect. And that makes it nice because, as a hygienist, sometimes there's certain things that you really like. And so it gives you that chance. And what some people don't realize is that Henry Schein is who we go through. We are their number 2 supplier or customer just behind the United States government. So we get a lot of really great deals and products. So that's always nice to be able to get those and pass that savings on to patients. And what I used to say is, I never felt like I had to sell because I would recommend these products anyway to my
Right.
patients, but now you have them right there at your disposal to give. So that's always a nice thing. So when you do your, when you have your regular patients come in, how does that go? Like, what's the flow there? Do you have an exam every time? Does the doctor come in and do an exam every time, or do you have a different amounts of types of procedures?
So our periodic exams is done every 6 months. Our bite-wings is taken once a year. We do perio charting, like I said, once a year, unless it's a patient that is a perio maintenance that's done at every single visit.
Perfect.
During that periodontal maintenance, if they have 5 mm pockets or greater, that's when we're going to talk about that antibiotic placement.
Good. Okay. So how do you discuss price with the patient? Do you do that, or how does that play out?
I leave that up to my office manager, and we have 2 office managers, and I just simply let the patient know a professional consultant will go over the financial avenues with them pertaining to the treatment care. Now, if it's something that's simply related to hygiene, whether it's Zoom, I can talk about the pricing when it comes to like the Zoom, the in-office and take home. The antibiotic, I can navigate through that as well.
Right. But the big stuff, you basically let that
The
up
big
to.
stuff like treatment
Yeah,
care planning when it comes to like
exactly.
overall comprehensive care. Now, if it's
Right.
just like a simple little add-ins, whether it's like a filling that's needed, I can also talk about that too. One thing within our office, once again, we multitask. So I have tapped into the knowledge of knowing what insurance benefits are being utilized and what's left. So I know how to navigate through the computer system to help save some time to talk about little things such as that, but just not the big whole picture of the
Right.
comprehensive care. I leave that to the office manager.
Right. And that is something also that we do a little differently with our patients, is we do a comprehensive treatment plan. And sometimes it's a big treatment plan because they have, what type, I mean, you can tell everybody, what type of patient do we generally see in our offices?
People that's in pain, people that doesn't have the financial avenue to afford the care when they come to our
Right.
office.
Yeah. And sometimes patients who haven't been there for years,
For years,
so,
yes.
they may have a very large treatment plan. Sometimes that doesn't make people happy. People don't like coming to the dentist, unfortunately. It's one of their, not so favorite places, but I think that we've had good success with making people feel comfortable. But sometimes if they haven't been there a while, we give them a comprehensive exam, and, it's a lot, and so, I mean, I always tell my patients, so in your office, do you do hygiene first? I mean, how do you usually, if a patient comes in with a very large treatment plan with lots of things, what's the first step? Is it the hygiene?
The first thing is to get the patient out of discomfort, if that
Right.
was their chief complaint. And then the second is the hygiene care, and restorative treatment falls after.
Right. And I
When we
think
always
that's,
ask, I'm sorry,
no,
we
go
always
ahead.
ask the
You.
patient what was their expectation when they came into our office.
Right.
And that
And
helps
that's
flow as well.
perfect. Yes. And that's what I was getting at. That really makes a difference for them to feel comfortable to start where they want to. But hygiene is so very important. And I know from my experience at private practice, that didn't always get done first. I mean, a lot of times you were doing prophies over perio because they didn't want to do it, and we don't do that.
No.
So, okay, so let me talk a little bit about a question that I always get with the students, and it's about training. Students are really very apprehensive about coming into an office and being thrown into a schedule of patients. Even though they've been prepared, you and I both know that, they usually have one patient every 4 hours. And so it's a little bit intimidating with them. So do we have any kind of a training program, and how does that go?
We have a training program. It's our HOP, which is the Hygiene Onboarding program. You meet a hygienist such as myself. You come to our office and we show you basically how to navigate through Aspen and get through the computer system just to become comfortable. It's like you job shuttle for at least 2 weeks to get the feel of how Aspen fluctuates, and then you'll go to your home office to start practicing.
Yeah, and that's really nice. That helps. So also, and you mentioned the hygiene onboarding program. It used to be, and things have changed a little bit with COVID, but generally after you're at the office for a certain amount of time, we send you to what we call HOP. And it used to be in Syracuse, and then they moved it to the Chicago, because we have a Chicago training center too. And what that did, at least for me, and maybe you can give some insight too, Gary, if you went to that, is that, number one, this just the getting to know people from around the country and really lifelong friends that I made there and that I still speak to, and getting to know our products, I mean, just the stuff that if you weren't used to using those in the office, even like Arrestin, I never used Arrestin before. It was never even offered, in any office I was at. So they give you CEs and they have the people and the reps come in from those products to tell you the why of what we do, and even the AAP guidelines. Did you go to the new AAP guideline CE class?
I did.
Okay.
It was last year in Indianapolis. So yes.
Okay. So yeah, with the new guidelines came out in 2017. And so that's something that we train our hygienists on. So, we stick it within those guidelines. So that's kind of a really nice thing with HOP. It gives you a lot of background and training and understanding about why we do what we do at Aspen. So tell me, Jay, basically what an average day is like for you. So when you come in the office, how does your day flow? What do you generally do first, and how does that go?
I set up for my patients, for each patient that's on my schedule, and then I start working on our production chair. During that production time, you'll get called by a dental assistant she'll do like a handoff with you. She'll let you know that she has a new patient. She'll give you the chief complaint, also their last hygiene visit, and then let you know if like a cleaning is their chief complaint. So to show priority. So then I'll have a mental note that we may be doing a same day start. I'll go in, I'll excuse myself from my patient. I'll go in and greet the patient. I'll diagnose, do a handoff with my doctor, and then I'll go back to treat my patient. Once upon dismissal, my office manager will come calibrate with me to do a same day start if that is what the patient is ideally there for. And then that's just how the ball keeps rolling throughout the day. But there's no pressure there.
Right.
It's just the flow of the schedule. Just the flow of the schedule.
So when we talk about support, we have many in hygiene support roles that help. So, and I'm sure that the most familiar one is with the territory hygiene manager.
Yes.
And sometimes what happens is people get a little bit scared off by, I have a manager that's going to come in and tell me what to do. Can you give me an idea of what your territory hygiene manager does for you when she comes to the office?
She helps you to learn how to become productive with your time, address any kind of concerns that you may have, to help with verbiage. It's like a mentor to help you become more proactive in your business and take ownership. I don't feel like it's more so of a negative situation. It's more just a positive, to learn how to just become a better hygienist and just become more confident and develop that relationship, not only with the team, but also with the patient.
Right. And so, part of us being under the same umbrella as far as the name Aspen is our verbiage. You could if you go to one dentist and they tell you need SRP, you go to another and they say you need deep cleaning, that gets confusing to the patient. Sometimes we take for granted that we know dental, but the dental IQ in the general public is generally low. And so they get confused. And sometimes, like you said, with the verbiage, it's kind of being on the same page so that, when you go to an Aspen, if you went to one in Indiana, or if you went to one in Pennsylvania, that you're going to probably get the same type of talk, the way we talk to you. And so you understand from one area to the other. That's a really nice way. And I'll just touch real quick on that. There's lots of growth in Aspen. My job is one of those. I was a hygienist in the office, the territory hygiene manager. We have division directors that oversee the territory hygiene managers. So there's lots of ways to expand your career. And even for you, Kiara, you're a trainer hygienist, correct?
Correct.
Yeah, which means you, with the new hires, you come in and you train them. Yeah.
Yes.
So that's always a great thing. So when you do your exam, is there ever a time where you refer patients to a specialist at all?
It depends on the circumstance. We refer sometimes to endo specialists if need be. We do have a practicing dentist that's also my dentist, that he does endo treatment, but there's some endo treatment that needs to just be referred out.
Mhm.
We refer out for peds, for
Mm.
children, if we do, if we need like nitrous to make them just more comfortable
Right.
within the dentistry. We don't want to frighten them at a young age. We do refer out for perio care when it's more advanced, when it's out of the scope of my skills. We will refer out, and then we'll simply just alternate the visits between a perio specialist and then coming back to us, just
Right.
as you would in private dentistry.
Exactly. Okay. And I do you have an oral surgeon that comes into your office?
We do once a month, yes.
Okay. Okay, perfect. So let me see here. Let me look at this. How about work-life balance is an issue, for a lot of people. And so how is that for you? What kind of hours do we have? And I know each office is different, but what hours do you work?
Let's see, Monday, Tuesday, and Wednesday, we work from 8 to 5. Thursday is our late nights. Typically around the Aspen board, you at least have one late night, and that's when we work from 8 to 7. And then Friday is more of our short day, and we work 8 to 3. You do ideally should be working one Saturday a month as well. But when it comes to work-life balance, I feel like I'm blessed to be with Aspen because they do give me that work-life balance. I do have 3 kids, so being a full-time hygienist, Aspen makes it work. I'm
Right.
blessed. They really
That's
make it
great.
work. Yes.
That's great. And we are about access to care. A lot of what our model is being able to be available and say yes to the patients. And so we do have extended hours. However, we're pretty flexible. I mean, I've talked to
Right.
people all over the country, and sometimes we do have part-time positions. We have float positions where you go around to some different offices in the area. We do try to work with our hygienist. And even though we have one long day, it's generally, and this is across the board, you have a long day, but you have a half a day on Fridays, which is
Right.
always nice. It's always nice. So what time do you get off on Fridays?
We actually get off at 2. The hours are changed 2.
Oh, 2. Well,
8 to 2,
still
I'm
2
sorry.
o'clock.
Yes,
That's
yes,
pretty good.
it's still fine.
Yeah. And some offices that do like a 7 to 12, and that's early, but I'm always impressed when a patient comes in at 7 a.m. to get their teeth cleaned. I've done that before too. So another question that students have is they're very big into community outreach. So they want to know, what do we give back to our communities that we serve? What kind of things do we do to give back to the community?
We have the day of service that we do to give back to our veterans, which I really do appreciate that across the board for Aspen to do that. Different community outreach. I believe it's more in the like bigger places. We don't have like the local, I believe it's like a bus that probably goes around. Is that
Yeah,
right?
the
Yeah,
mobile
I've
mouth
seen
unit.
it, the mobile mouth,
Yes,
yes, but we don't have it
correct.
within our certain area. I've seen it come out, but the thing is with the whole COVID, that kind of,
Yeah,
it did happen.
right. Yes. The mobile mouth unit, actually, we have a complete staff that does that, and they have a schedule, kind of like I always say it's like a Bon Jovi tour. They go on tour, and they hit certain cities, and they treat veterans for free. So veterans are a big important part on at Aspen. And the other thing we do is once a year we did the mission trips, and I think we did like Haiti
I've seen that.
once, and Guatemala, I think. And so that unfortunately has stopped due to COVID. But so back to the office, what type of, and most schools or hygienists out there, if they have a software system, it's EagleSoft or Dentrix. What software system do we use?
We use EPMS. It's a Aspen software. It's really easy to navigate through. It's something that you just have to get used to. And when you train with your hygienist, you will become accustomed to the software. It's pretty flexible and just really easy to navigate through.
So that's part of their training process. And
Yes.
honestly, for me, I think that was the hardest part, is to just learn the software system, because I was so 19 years in a private practice. You just get set in your ways. But yeah, so
It's
once you
really,
navigate that,
yeah, it's easy to navigate.
Talk a little bit about the bridge. I love the bridge because I think it's a really nice tool for hygienists. What does the bridge do for you? What do you use that for?
It's for education. It helps you take ownership and being a hygienist. Has a lot of research resources there for you to navigate through. That's where you will purchase at. That's where you look into like your time card. It has unlimited resources pertaining just Aspen as a whole. If you have a question, all the answers is in the bridge. It also has your metrics that helps with your performance as a hygienist to help to see if you're on track or if you're getting off track. There's a like a grading system for you as a team to see how your office is doing among one another. So it lets you know if there's a great communication there and if it's just a strong bond with you and your team. The bridge
Right.
is it's just it's a resource. It's a education resource for you. You can do continuing education as well.
Yes. And
There is a lot there on the bridge. It's a
so
lot.
the continuing education, is that something that we provide?
They do have resources, Aspen do. They have the Aspen Dental Learning.
The
That's
Viva Learning?
is a Viva Learning,
Yeah.
yes. They also have like live web seminars that you can tap into, tailor around your schedule. They also it's just they have a lot of just journals. There's a lot that Aspen offers for continuing education.
Right. So I think you touched on this, and I think it's important to say this because, it goes off of how, our patients are very important to us. So you do get us an incentive, the whole office does, based on patient satisfaction, and
Yes.
so, and that strives for us as clinicians and, as the office to, like you said, work together. Sorry. And work together and, make the patient experience good for the patients, you know so that's an extra bonus that you can earn, just for, doing what's right by the patients and making them happy. So what do we do implant do you do it do you guys do implants in your office?
We do. Our oral surgeon does.
Okay.
Yes.
And you do implant maintenance as a hygienist?
Yes, we do.
Okay.
Yes.
And so that was a new concept to me, honestly. I'm an old school hygienist and we didn't have a lot of implants, and especially in private practice, there weren't a lot that did implants. So what does that look like when you're doing an implant maintenance? Because some people, I think, get a little bit intimidated by that. What do you
No,
do for an implant maintenance?
you'll use the proper instruments, titanium instruments around the implant when you're cleaning the patient's implant. Also, if you utilize the ultrasonic scaler, you have the tips that goes over it with the correct instrument to do the correct instrumentation. It's really no different than treating anyone else with the natural dentition.
Right. Good. And I used to love changing O-rings. That was like one of my favorite things. But the nice thing is that we mix it up. You don't have
Yeah.
the set amount, prophy all day. That burns you out big time. So there's a
Correct.
lot of burnout in this job because of the constant. So what I loved about Aspen is that we had different procedures, and they don't want you to do prophies all day. They kind of say, okay, limit yourself to maybe 4. At least in mine. Did you guys have like a smart scheduler that you
And I was
used?
going to say that, well,
Yeah.
to help alleviate that, you have the smart scheduler, which when you schedule your patient, it will basically just scatter patients out 3. So you have a nice balance, whether it's periodontal maintenance, prophies, and scaling and root planning. It's just the perfect blend to help you have a productive yet not boring schedule.
Exactly. And boy, that
Yes,
makes it really makes a difference. I'm
it
telling you.
does. It does. It does.
So the smart scheduler is nice for that. So let's see. Let me see here. Do we hire new graduates? I talk about new
We
graduates all the
do.
time. Is that something we do?
Yes, we do.
Good.
Yes.
Okay.
Yes.
So the metrics, that is, again, that sometimes scares people when they hear that. And you touched on this a little bit, but can you just explain a little bit about what the metrics does for us? And I can give my 2 cents on the metrics because I actually love them. So what do you look at those for?
The measures, you can look at your daily production. We call it period or prophy ratio because we know the vast majority of our population has periodontal disease and it's unaware. So it helps you just look at your community as a whole to see if you're treating properly and just not simply under treating, whether it's black or white and just not a gray area. Just make sure that you're treating according to what you actually see. Um, It also just helps just build your hygiene business, as far as just looking at you as a hygienist to do a self-assessment to see if you're using like the correct verbiage, if you're using the right time management, as far as offering the right products to the patient. So it's just a lot on the metrics that just helps you look at your performance as a whole.
Right. And I agree. I love the metrics because to me, it was like my own little competition of seeing how I was doing and how I was doing right. If I had a scaling root planning patient and they had no take home products, I
Right.
feel like I kind of left them go to be on their own without any help, you know? And so I was always, was it that they didn't accept? And that happens sometimes. And you just have to educate the patient and hope that maybe next time they'll take your advice. But, or was it that I didn't offer that, or did I
Right.
not talk right on that? So to me, it was just kind of a little of keeping myself in check, and not so much that the company was checking up on me or my doctor was checking up on me. You know, it was never to me about that. It was more about my own self. Because
Yes.
we say this all the time, Kira, and I'm sure that you've said this, is when you do right by the patient, everything else falls into place.
Both. It
You know what I
does.
mean? I mean,
Yes.
you never have to worry about money at Aspen. We pay our people well. The incentive is very easy. It's a profit sharing incentive. It's very easy to attain if you're doing right by the patient. You know, there's enough out there with patients that, you know, that we never have to try to find things to do. So,
Right.
you know, that's always a really a nice thing too. Do you have any good stories of patients, like a yes story? Do you have any stories where patients were resistant, or, you know, you got something good going that they weren't expecting?
We always have a lot of good stories. A recent story was yesterday. I actually had a lady cry in my chair and tell me just how I was actually nervous for a minute because she started tearing up as if was taking the bib off of her. But she broke down and just told me how she was appreciative of how gentle I was with her. And she felt like God blessed my hands. And she was just very nervous. And she hasn't been to the dentist in a very long time. And it took her a lot to get into the chair to even just gain that trust for me to do the correct performance that I needed. Which I was thankful. And then after I walked her up to the office manager, she also had thanked them up front for just helping navigate through the financial avenues to really just to get the care started. She was on a fixed income, and it's good to help people because people are
Mm,
scared to come there. People are scared of judgment, and I feel like Aspen is a non-judgment zone.
yeah,
Like we're just there simply to just help you. So that really just touched my heart and made me humble as a hygienist because I treat patients the way that I want my mom to be treated. I would want
right,
me to be treated. So I just take a passion in it, and Aspen stands by that passion that drives me as a hygienist.
right. And you know, so I wholeheartedly believe in that. And I feel with everything I have, and this is why I do this job every day and why I put myself out there to bring, you know, to bring you on, who you're a very good role model for Aspen, is because I totally believe in this model. And, you know, even up to the CEO of this, of my end of the management side, he's very passionate about that. He's passionate about, you know, treating everybody like they were your mother, because, you know, when you give the right patient care, you know, that's what we're here for. You know, I
Right.
mean, obviously this is a business, your hygiene business, any business, but we treat the patients right. And I just believe in that with Aspen. So let's go back really quick. And this is a question again, and I wanted to talk on this when we were talking compensation. So we know that you don't get paid commission. You don't have to worry that your paycheck isn't going to be, you know, what you are if you don't have a patient. So the other thing that I see and I read it, I'm always so shocked when this happens, is that patients are getting sent home, or not patients, hygienists are getting sent home, or they are having to clock out when they don't have a patient. And I think, unfortunately, that's you know, something
Yeah.
that's being said in the corporate slash DSO world, that kind of gets a bad name for everybody. So, do we do that to you? Do we make you clock
We
out if you don't?
don't. We don't. If you really are clocking out, it's because you want to. And when I say that, it means that you're not utilizing your time wisely. There is ample opportunity to do things in the office. So if I have some downtime, is what we call it, you have certain reports that you can run to basically help just get those recare patients back in the flow, because people have daily lives and sometimes they forget. So it's a great reminder to just to phone your patients, or just simply confirm your patients for your next day or next week approaching visits. One thing that I also do a lot within my office is teamwork. So whether it's doing the new patient, taking x-rays, helping with sterilization, just finding out where you can be inserted into the office to help out your team players. Because when they see that relation build between the team, the patients want to come back. So you just have to really be proactive in the office. So if you're clocking out, you're not utilizing your time.
Right, right. So, we do offer guaranteed hours. So if we tell you you're going to get 32 hours, you're going to get 32 hours. I think 32 is full time for us, which allows you to have benefits. But, we never make you go home. There's always, like you said, something to do. And, a lot of times for me in my office, there were times when my office was a fairly new office, so we were slow. But with that new patient, it always gave us a chance to say yes to those new patients and get them treatment today. So my hygiene manager was always like, hey, it's okay if you have some time at the end of the day. It's okay if you have some time in the middle of the day. You can either, like you said, call patients for recalls and remind them, or you have a new patient that might need acceptance. Now you can say yes to that patient and get that patient out of pain. A lot of the perio causes pain, get their infection started to be treated today. I mean, that's where, that's what we're about. So that's always
today. So today was a perfect example. Unfortunately, I only had one patient in my morning schedule. I was able to do 3 same day starts. Right. So you'll find time to utilize your time. So I wouldn't worry too much about the schedule. It will come. Just make sure you're taking care of the patients when they come.
Exactly.
So it'll fall into place.
So I always ask this question because, sometimes it's a taboo question, but, we say, ask me anything because we mean that. And so, I have students that are a little bit afraid to ask this question, and it's about negative press. I mean, we can't deny it. You get people, you get negative things said. I've had hygienists who, that are like, oh, I heard Aspen this, and I heard this, and I heard this, which is a lot of the reasons why we do these, ask me anythings, to get some of those misconceptions out of the way, because it's really important that we let people know what we're really about. And a lot of these are coming from people who've never worked for us. It's just a general rule that DSOs are bad. And because Aspen is the largest branded DSO in the country, then we kind of get the brunt of that. So how do you handle negative, if somebody says something negative about Aspen, or if you hear negative things online, how do you handle that?
So when it comes to that, I don't let negative opinions define my positive experience with Aspen. Every job has its ups and downs. No matter who you work for, you have to still be able to be who you are and do a self-assessment of yourself. And with that being said, in that moment, you will have to tap into a greater you to basically just work to notice who you work for. So if you're doing a self-assessment, you will know who you work for. So I view myself as like an asset. And I'm passionate about being a hygienist, and in turn, I hope my employer sees that. And within my particular experience, my employers, they see that, and they really are supportive. So I can't speak anything negative. And when it comes to negativity, you just have to turn it around, because everything has their ups and downs.
Right. And, I always tell people this too, and this is how I handle negative press. Number one, I got into this job so that I could talk to hygienists at a hygiene school before they got negativity, and they could actually say, we offer to any hygienist that wants, come into our offices, shadow, especially for the new hygienists coming out. If you feel like we don't hold you, did you have to sign a contract when you started with Aspen?
Like, what do you mean?
Like, did you have to sign a contract saying that you would stay with them for a certain amount of time?
No.
Did you? Did you say, did they tell you couldn't work?
No.
No. And we do that same thing with our dentists. When we hire a dentist, they don't sign a contract. They are not held to be, to stay there for any extended period of time. They could open another office across the street, and that, we do that we do that because we're confident that we are doing what's right by the patient. So sometimes with the negative that comes in, and you can attest to this. First of all, I always tell people to look at our patient base. So we do have patients that haven't been to the dentist in a long time. Those patients are already leery of the dentist. So they already have come in with a fear. And so when they have a large treatment plan, that kind of gets to them. So you'll see that. The other things in dentures, tell them a little bit about our labs. Do we send our dentures out, or how does that go?
We have an in-house lab. So the denture is fabricated within our lab, within our facility.
Right. And we do that so that our lab tech is right there with the patient to see their mouth. And that's so important when you're doing a denture. Dentures at their best are terrible. You know what I mean? They're just not like your regular teeth. And so our denture patients, when they come in, they have a very high expectation, and the best denture is here. Okay. And so when they get that, they get upset. But we offer a money back guarantee on our dentures. I worked in an office. We've remade dentures many times, to make people happy. And now we're doing implants for implant dentures and things like that. A denture is a very difficult thing. So that's always somebody who may complain. And of course you have employees that we look for the best people. I mean, Kara, what type of employee do we want in an office?
Someone that's motivated, that's motivated, compassion.
Yeah.
Someone that just can sympathize just with the patient. Someone that takes ownership. I think that's a big thing. And like I said, you have to know how to multitask.
Exactly. Multitask and a team player, like you said. I mean, you
just
want help driven. Exactly.
Yes.
And so we are not for everybody, because not everybody is like that. And we understand that. We want the best, because I always say we're only as good as our people, and our teams. And so, we look for the best type of people. We look for the ones like you, Kira, who is a leader in your office, and who's willing to go above and beyond for the patient, and get that satisfaction of, hey, I had a patient who cried in my chair because she was so thankful that we were able to help her. And that's the core values here. So it's nice to be able to talk to you and get your perspective on it, and get the word out to people about what we have to offer. So that's always a great thing to do. So one last question I always ask, and I'm not putting you on the spot, but this one is, we say that we are a yes company. Okay. So what does that mean? It means saying yes to treatment. You have a toothache. Yes, we can get you in today. You want to get your treatment done today? Yes, we can start that for you. I mean, that's something that we're really big in. So how has that affected your career? Like what would you say that Aspen's yes for you is, as far as your career? How has Aspen changed your trajectory of your career?
It's just urgency is how I look at yes. So it doesn't bother me. Yesterday is when it gives you that push to deliver the care for the patient, and just the urgency behind it, just treating the patient and just their expectation. Every patient comes to any dental place with an expectation, and fulfilling the expectation is a must when you're doing the yes today.
Right.
So that's how I look at it. Yes, it's no pressure. It's just, if you're there for the patient, it falls into place. So you would say yes. Absolutely. You don't want to say no.
No, absolutely.
No, you
and people don't want to hear. People don't want to hear.
Right? No, they've already they got it made in their mind. So
exactly.
Yes.
Exactly. And when you are at the dentist, if you're offered treatment, you're not. Sometimes you don't come back because you're afraid. Patients are scared of dental work, and so that allows us, like you said, with the time and the schedule, it allows us to be able to say, hey, you know what, you're here. Let's get this done and get started for you. And they feel so much better after that happens. So anything else that you want to add? Anything that I didn't touch on or we didn't ask? Questions that you felt were important? Anything else that you want to say?
I I think we addressed it a lot. As a hygienist, if from whatever background you're coming from, whether you're a new hire or experienced, it doesn't hurt to try Aspen. I really do feel like they really do help you just grow as a hygienist. I do know some people that I train, they're always worried about like the times that you may have with the patient. That fluctuates. So it's tailored around what your individual needs is. The idea is to make you productive and just develop that relationship with your patient. So it's just, you have to have that team built with your doctor and your office manager. It's really important. And you
Right,
will
that
get that support that
communication.
you need.
Yeah,
There's so much support there. So
yeah,
much support with
that
Aspen.
it really is true. And you, like you said, communication is key. So communicating with, and again, real quick, because you just said it, and I'm glad you did because I forgot, was the time. You say, do you have a certain time? I mean, like, are you say, or do they say to you, you only have a half an hour to do a prophy, and you need to be able to do an SRP in an hour? I mean, like, how does that work?
They have guidelines that they recommend, but you tailor your own schedule. All my patients across the board has 1 hour, but that's simply so I can see my new patients and ideally start, a patient on that same day. But I know my personal preference, and my office manager knows my personal preference for my time. So we know how to like dictate the schedule to make it just more productive for you and just accommodate the patient needs.
Right. And, that's again, what back to the new patient exam, and how we do that is that you see that new patient prior to them having anything scheduled. I know for me in private practice, it was like, okay, you got an hour for a new patient or an hour and 15, but they could come in with 4 quads of scaling and you're not going to get
Right.
that done. But that
Right.
patient's expecting to have a cleaning. We tell our patients right up front, you're coming in for a new patient evaluation, full free. It's free because we're going to take x-rays and do all of that stuff, but we're not guaranteeing you that you're going to have anything done, but because we need to evaluate what you need. We need to see what your needs are. And that way that gives that patient that they're not expecting a cleaning because, and then, once you see that patient, what exactly they need and how much time. And that's what I used to do. I'd see a patient and I'd usually, I've been doing this for 20 years. I could get an SRP done, pretty quickly, compared, but I also had patients who had calculus on their teeth from 1970. And I was going, okay, I need 2 hours for this patient. So please block 2 hours. And I was able to do that. I mean, I had full autonomy in my schedule and they didn't question me. You're the clinician, you make the treatment plan, and, my doctor and my staff backed me with that. So that was always a really nice thing. So
And I
I
feel
want
like
to, yeah. No,
I feel like that's
please.
a big thing because you mentioned like the 4 quads SRP. So with asthma, another thing, you treatment plan accordingly. So you don't have to ever worry about doing a prophy on a patient that that has periodontal disease that's simply just declining treatment. You treatment plan what you see, and then you'll gain that trust with the patient and they'll go accordingly. So you're not going to have a crazy schedule that's really not true prophies. It's either a prophy or it's gingivitis or it's periodontal therapy. So
Right.
you treatment plan accordingly. There's no
Yeah.
setbacks. It's honest. It's honest
Yeah.
dentistry.
Yeah, absolutely. And it's funny, I was reading one of my forums and there was a hygienist on there that she went to an office and, she saw that this patient needed quad scaling. And the dentist said to her, okay, well, just go ahead and polish them anyway, too. That way they feel like they're getting something done. And she was asking advice, like, what do you do in that aspect? And I said, no, and I would never at Aspen been asked to do that. That's just a no. You just don't do that. That's your license on the, and that was what I loved about Aspen is that was never required. That's not the way it went. It went by this patient needs this, and you can't go backward from that. Prophy is a preventive treatment. They have disease. You can't do a preventive treatment, and they stood beside us, or behind us on that treatment.
Right.
So, which is really nice. So that's a great thing too. Okay, well, you know what? We are getting close to the end of the time. So I want to thank you very much.
Thank you.
Yes, it was so nice to have you on. I think we really answered all the questions that I had and pretty much gave a really good rundown on how we run and what our offices are. So thank you, Kira. I appreciate you
Thank you
taking
for
the
your
time out of
time.
your day, and I hope to work with
Thank
you
you.
again.
All right. Thank you.
All right, have a good night. Thank
You
you.
too. Thank you.
Bye-bye.
Bye.